Hi, I am Dr. K Madhusudhan, consultant neurologist and head of the Department of Neurology and Stroke Service at Aster RV Hospital, Bangalore. Today I am here to highlight a little bit about the stroke to create awareness among the community. Stroke is nothing but whenever the blood vessel get disrupted due to the blockage of the blood vessel or disruption of the blood vessel, this causes a damage to the brain that is called as a stroke. Stroke is of two types. One is called infarct, that is the clot in the brain causes infarct. Second thing is hemorrhage, that means bleed, that is whenever the blood vessel rupture or burst, that is called as a bleed. So what are the risk factors for the stroke? Major important risk factors are hypertension, diabetes, alcohol, smoking, and obesity, dyslipidemia, that is the cholesterol, increase in the cholesterol. And there are a lot of varieties of stroke, like depending on the vessel blockage, like large vessel disease, small vessel disease, cardioembolic strokes, and stroke of unknown etiology also. So how you identify the patient with stroke is, remember the mnemonic called FAST, F-A-S-T. That is B fast, B-E-F-A-S-T. Now it is called as a B-E-F-E-S-T. B fast means what? B stands for whenever there is a loss of balance, you should think of stroke. E stands for eye problem, that is double vision or disruption, double vision or a decrease in the vision or sudden loss of vision also sometimes can be a cause of stroke. And then F stands for facial deviation. Whenever the face gets deviated to one side or whenever the drooping of one side of the face is there, then it may be a stroke. A stands for arm drift. Ask the patient to lift his arm if the arm drops, or when the patient is walking, if he is dragging the feet, or when there is a loss of power in one of the limb, then it may be a stroke. Then S stands for speech. Whenever there is a slurring of the speech or sudden loss of speech, that time also you should think of stroke. The last T stands for time, that is time is brain and brain is time, because every 1 minute if you lose, you are losing about millions of neurons. That may be a amount of nerve cells which are going to die. It amounts to about 17 kilometers of neurons will die if you lose 1 minute of time. That is why brain is very important. Time is brain, you should save time. So what is important now is, immediately if you see any of the patient with B fast symptoms, then immediately you should rush to the stroke ready hospital. Especially we at Aster RV Hospital is a stroke ready hospital with stroke ready emergency, stroke ready ICUs and interventions and thrombolysis facility available. We have got a magical drug called as the IV thrombolysis, where we use a tenecteplase and the tissue plasminogen activator to burst the fresh clot if it is available. And sometimes we do the neuro intervention. If the clot is there blocking the vessel, we are going to remove that block like what they do for the heart. Similarly, we are going to remove the clot from the blood vessel and we can save the salvage lot of brain cells, that is called penebral area, can be saved. So next, what is important is prevention. How do you prevent the stroke? You should maintain the healthy lifestyle, eat well, and you should do normal physical activity every day, avoid stress and take medicines regularly. Thank you.